Okay, well, good afternoon, everybody, and welcome to our Public Council of Governors meeting. Thank you to everybody who's been able to join us. And I know we are expecting a few more people. I think a couple of people are running a little bit late due to other challenges that they're dealing with at the moment. Well, we've certainly had a few apologies. So just to confirm the apologies we've had, David Jones, Bev Sturgis, Fiona Judge, Sue Watts and Lloyd Cox. I also know that Scott Adams, Tracy actually sent his apologies due to a clash with his job. And Angela is joining us, but she is currently at an important stakeholder meeting and will be with us within the next hour, hopefully. So just in time, I think, to be able to lead on the Chief Executive's item. So we look forward to welcoming her later. So first of all, also wanted to note that this is Fiona's last meeting. I think we will be saying more to her and more about that as we go through the session, but just wanted to note that at this stage. Declarations of interest for items on the agenda. Is there anything that particularly people wanted to? I know we've got our register, but I just wanted to make sure that we do have any declarations for specific items on the agenda today. Okay, I can't see any hands up, so I'll take that as a no. The minutes of the previous meeting, now you'll recall that unfortunately we had to stand down our public meeting previously because of the sad passing of Her Majesty the Queen. And as a result, we actually conducted the meeting we did have in private. So the July minutes of the public meeting that took place in July are actually available for your perusal today rather than in our public meeting, obviously because the public meeting didn't take place in September. So can I just check whether everyone's happy that set of minutes for July is accurate? Any concerns that or corrections that people wanted to bring to my attention? Okay, none. So thank you. I'll take that as approved. We've got no outstanding actions on our action log, I believe, Tracy. So unless Richard or Tracy wanted to come in on that, I think we can say that we can close off our action log as well. Okay. Great, thank you very much. So we move on to the core of our business, and I think it is Fiona who's leading her last Director of Corporate Governance report. So this is a moment, as I said, to mark her last report to us, and of course we will take the opportunity to recognise her contribution as well. But without further ado, over to you, Fiona.
Thank you very much, and it does feel kind of like the end of an era, really, today, with this being my last Council of Governors meeting. So without any further ado, I'll just draw your attention to a couple of important things. The first being that at long last we have got somebody in the role of member and governor lead. It is Tracy. She's acting up into that role for the next few months, and we're actively recruiting to find somebody to do her usual role. So possibly by the time of the next council, certainly by March, we'll have more news on that score. There is quite a bit of interest in the role internally, so I'm hoping that, as I say, come January we'll have some positive news. But I'm really pleased to see that. I think Tracy's developed a huge amount in the time that I've certainly been with the organisation, and I think it is really important to try and grow our talent where we can. So that was the one key thing that I wanted to draw your attention to. And also that, you know, I noted a couple of changes to the membership of the Council of Governors meeting. We'll probably touch back on that when we go into our meeting this afternoon, the private part of our meeting this afternoon, when we consider the Council of Governors composition. But attendance is really important to make sure that we transact business as effectively as we can, and making sure that all facets of our communities are represented. And so making sure that we've got governors that are on the council that are able to attend and that are in key seats that gosh, there's lots of messages coming through. That's certainly a kind of key focus for us, kind of over the next few weeks, really, over the next couple of months. And just reporting on a couple of things that have been done by since we had the last meeting. So obviously at the last council meeting, we, in our private session, we took a couple of recommendations from our non-rem, and I'm really pleased that we are actively recruiting to our kind of non-executive director vacancies, and Carol will speak a little bit more about that when we come on to the non-rem report. And I think really that was all I wanted to particularly draw our attention to. The APMM, again, very well attended, and another really good session, lots of good feedback. And we've got a good plan of action for the next for planning for next year. So I'll stop there. Conscious that we never have quite enough time. I'll stop there. But just to say, I am really proud to have worked with this council. I think it's changed a huge amount over the year, you know, over the two and a half years that I've been here. You've made it an absolute pleasure to work with you, and I'll take a lot of what I've learned and your very, very good wishes. You've been very kind enough to give me lots of good wishes and presents, actually, lots of presents, more presents than I realised I was going to get. So my little mini was kind of quite laden down, kind of returning back home. But I just wanted to say a huge thank you. I will miss all of you. I really am going to miss all of you. And, you know, if my next council is half as good as you, then, you know, I'll be a very, very, very lucky Director of Corporate Affairs.
Thank you, Fiona. What a lovely tribute, well, tribute to yourself, but also tribute to the Council of Governors, which is really lovely. I'm glad that yesterday, hopefully, was, sorry that I wasn't able to join, but I know you'd planned some goodbyes with people, and I'm sure it sounded like it was really lovely. Couple of things just to add myself. We just wanted to highlight that it is actually also Maria's last COG meeting. Maria Wogan, who is obviously one of our long-standing non-execs, and Maria, as colleagues will remember, let us know that she'll be stepping down at the end of December. So I really just wanted to highlight that, but also to remind everybody that the council have agreed to appoint Julia Curtis as the deputy chair, and I'm sure Julia is looking forward to having the opportunity to chair this meeting as part of her development, something that I know Maria did at one point as well. So actually all those things will be important for Julia to do. And as Melanie's rightly put in the message, that we are going to miss Maria too. So we're saying sort of kind of goodbyes to two people, although Maria's actually with us a little bit longer before she actually disappears over the horizon, but it is her last COG meeting. So just to say a huge thank you to both of you in that context. And I don't know, Chris, if you want to come in at this point, or do you want to leave?
No, thank you. I was going to put my hand up, but it's a good time. Thank you. Yeah, it would be remiss of me as lead governor not to acknowledge three of your collective contributions that you have made to the life and work of NHFT. And first and foremost, in no particular order, but Tracy, I would go as far as saying due and just recognition for all your loyal and faithful service. You are a friend to the council. As governors, we know you well. We've appreciated your support, your friendship, helping us when we needed to know where to go and how to get things done. And we look forward to working with you in that membership engagement representation role. Secondly, Fiona, thank you too for all you have contributed to the life and work of NHFT over the last few years. And it was finally a good also to acknowledge Maria. Thank you for the reminder, Krishni. Maria, thank you too for being a friend of the council. Thank you too on a personal level. Looking back at the AGM, APPM we had at the Saints back in 2019 and for your support with that, which has left a long legacy and still continues to do so, raising issues around mental health in our elite sports clubs across the county. So thank you, Krishni. Yes, I think on behalf of my colleague governors, we would like to acknowledge all the help, support and contribution that Fiona and Maria have made and look forward to working with Tracy in the future.
Thank you very much, Chris. And also, if I bring in another Chris Oakes at this point on behalf of the executive team and board. Chris?
Yeah, I think just echo what Chris was saying, a huge thanks to Fiona, in particular, working with the exec team, working with the corporate governance team. She's brought a huge amount to the organisation, a lot of, I think, leading edge governance advice, we would say, that has helped us grow our approach, and in particular the Council of Governors. And you know, I know her new organisation are going to be very pleased to receive her and have that expert resource. It's, you know, big thank you from me, but an appreciation of the impact that she's had, which I think we all know. And I'll echo the congratulations to Tracy, and obviously thank you to Maria for all of the excellent work she's done for the trust as well. So very positive, and we will miss the pair of you leaving. So thank you very much.
Thank you, Chris. On that very positive note, albeit, you know, it's always sorry to lose people, but equally, I think people move on to other exciting things in their journey. Chris, did you want to make a quick another comment before we move on?
If I may, sorry, a change of gear and a change of direction. Yeah. Just there was a couple of things in the report. I'm not sure if this is
yes, please
time to raise it, but
yeah, please do.
And again, my apologies, it's going to feel like a shift in energy, but three things, if I may. The first of all, the stress awareness seminar, really, really good. It was good to see we had 40 on the call. I think it just goes to show that where you have a good subject, a good speaker, we got our comms better. Still not quite there, as I raised and as recorded in the minutes and action log, particularly about those who are not on email, but the fact that you have to book, I think helped in generate interest. The one point I just want to make as an observation is that I noticed that there were a lot of staff on that call because it was circulated internally. And one thing that certainly in the 4 years I've been a governor, I've never quite had a sort of satisfactory explanation or rationale as to why staff aren't members. And this is something that we have raised at the Membership Engagement and Representation Group. And I would like to suggest we do so again at our December meeting on the 8th, because we are an outlier compared to other foundation trusts, both locally and nationally. I'm not looking for an answer now, but just an acknowledgement numbers may have been boosted because it was a good resource for staff, and it was good to see colleagues on the call. The second issue is just some advice, please. In your report, Fiona, you talk about the changes in the governance code, and on page 4 of your report, you've made reference to the fact that our responsibilities as a Council of Governors do not change, although our responsibility to represent not just members but members of the public is, if you like, widened to include not only the population of the local system of which we are part, but the whole population of England is served by the wider NHS. So can you just, again, not necessarily looking for a detailed answer, we can pick this up perhaps at the MER workshop, but what do you see that and your expert advice on that, please?
Fiona, do you want to
Yeah,
comment on
I
that
will.
and also just comment on the staff membership
Yeah.
issue? Because staff are members, but I think there might be a question mark about automated membership, or membership by default, which I think has been a question that we've debated in the past. Fiona?
So I'll take that one first. So our expectation, and you're absolutely right, Chris, we are unusual in that we don't have an automatic staff opt-in to our membership categories for staff. And we will be touching on this a little bit again when we look at the COG sort of composition and where might we go next. In fact, on both of these points actually. So a little bit more in private this afternoon with a view to bringing stuff back in public. But certainly our anticipation is that we will use next year, as in the next reporting year, predominantly the next calendar year as well, really the next 12 months, once we've got the membership database, to really start an internal campaign with staff to actually talk to them about opting them in, and they would then have to opt out if they wanted to. And then we will use that to actually think about, might we need to think about what categories we have for staff? Is there an opportunity to look at any realignment we do in terms of looking at our workforce profile and so on, to make sure that we maximise attendance for staff? So certainly that is on the cards for next year, and then that will come into place for when we have the majority of our staff governor vacancies that will come up in 2024 when terms end. So next year, key year for that. In terms of the kind of representing the wider interests of the public and the public at large, I think that is the new terminology. I like you, certainly at my new trust, and as you will be at NHFT, will be starting to scope out what that might actually look like. I certainly think that our first focus should be looking at how we garner support with other foundation trusts and other councils of governors in our county, in our ICS region, and then look further afield at what we might want to do and how we might wish to engage people more broadly. I think it's still quite new and emergent, Chris, and I don't think anybody's got a kind of a blueprint for the. I've just realised you can't see me. A blueprint for this. So I think it's quite an exciting time to actually work out, particularly on a regional basis, what actually might work best for people. So I think kind of exciting new times and an opportunity to actually carve some things out together. But I certainly would be advocating some closer working with KGH in the system to help work out what this might be. And I think the joint meetings that we've had with KGH already is absolutely sets us up really well for it.
Thank you very much, Fiona. In fact, in that respect, Chris, I think we're further ahead because we've already had quite a lot of conversations, if you like, with governors across the system, which obviously in our case is just KGH. And I think the key distinction is sort of differentiating between focusing on the people that our trust serves as service users of our organisation versus the public at large within the wider community of Northamptonshire, because of not everybody uses our services, and I think that's probably the really key thing for us that we need to be able to do. But it is, as you can I think probably would expect, it's a key topic of conversation amongst chairs, I can say that, to sort of understand what does this mean. And I suspect we'll, as Fiona rightly says, we'll be going through a journey together. One actually other interesting thing I wanted to mention, and I think this is something I think we've said before, we'd really like to think more, perhaps more laterally about, how we can perhaps utilise the council and its reach into our community to help to sort of increase that feeling of representation, and particularly in terms of how our public, how the community engages with NHFT and the NHS more generally. And something that we'll be coming back to is that I had quite an interesting approach from one of our team who wanted to ask about how we might use the power of the council to help promote the IAPT service into our community. And I think that's a really good example of something that would be really good to have a conversation about. And I think Fiona and Richard and Tracy and myself had a bit of a thought that we might bring that to the membership and representation group that's due to take place in December, I believe.
Exactly, yeah.
Because
Absolutely.
it felt like something like that, which is, you know, the IAPT is a really important service. It's something we want to promote into our community, and how we might equip governors to help us do that, and that includes KGH governors, would be a really, really purposeful and meaningful thing for us to try and do. So so it's definitely something that I'd like us to come back to collectively and talk with you about how you might be able to help with that. Does that sound okay? Is there anything else that people would like to raise a question on in relation to Fiona's report? Fiona's final report, I should say, which Richard will take over in future. So I'm looking forward to that too. So thank you very much, Fiona, and thank you for your questions, Chris, as well. Okay, well, we move on then to item 6, which is the purpose of which is to provide an update to the council on the governor conduct work stream that's been taking place. And there is this involved a group of I think governors and non-execs inputting, and Melanie Hall, one of our non-execs who you all know, and Chris as lead governor have very kindly agreed to present the findings or the work so far from the working group. So over to you both.
Thank you. Can you hear me okay?
Yes, thank you, Chris.
Yeah, I'm going to start off, then Melanie's going to come in. We're a bit of a double act.
We are.
As Peter can't join us today. I think just by way of background, I'd like to thank Peter, who has taken the time to listen to us, both individually and collectively, as governors, together with our non-executive director colleagues, about this really important issue. You've got the report before you, paper E. We're going to use this slide as a prompt. And I think just briefly from me at the start, it was clear as the report sets out that there was a need to review Annex 6, our code of conduct, look again at the potential for a concordat or a charter about our behaviours, our values more aligned to the Trust's values, and also lessons from the previous use of the dispute resolution procedures as set out in Annex 6 of the Trust Constitution. So this report sets out the context, the background, an update on the work to date, and also next steps. I'll hand over to Melanie now.
Hi, yes, thank you, Chris. And I think just wanted to bring to life maybe some of the background work that Peter has done and how we've all been engaged, because what was very clear from the start was that there was a tremendous amount of knowledge and experience from many different parties across the council, with reflections and sort of experience of participating, particularly in the Annex 6 process, but of course also in the Governor Code of Conduct. And I think Peter has taken, as you'll see in the report, a very inclusive, in fact, a particularly inclusive approach to this, not only having a series of workshops in which we have gathered together to have a broader sort of range of discussion against Peter's very well organised agenda, but also he has opened up the opportunity for people who maybe didn't feel particularly confident or happy to discuss that in the broader forum, to have personal engagement with him. And he has spent a lot of time having individual discussions with people such as myself who've been involved in previous sort of Annex 6 processes, and, you know, using the policy and procedure and process that we are seeking to redesign. So I think, Chris, I'm sure you'll agree, I think Peter has really sort of cast the net as broad as possible to gain as much feedback and learning as possible, and then beginning to work it into the shape of the way that we move forward. So thank you, Chris.
Yeah, again, just building on those comments from Melanie, I think it's interesting in terms of the importance of this to governors. Before the first workshop, I contacted as many governors as possible, and we had 14 governors on that first session, and the importance cannot be underestimated. In fact, you know, we had more governors on that call than we did at our last full COG meeting, and I think for me it shows the benefit of that personal contact and not relying just on email to engage with governors. And I think this is important because, again, I'd like to thank Peter for taking the time to listen to us. And clearly some of the issues that were fed back overlaps with the Council of Governors Effectiveness Review, which we will receive an update on in the second part of our meeting. But I think it does speak volumes of Peter, as you say, Melanie, and his inclusivity in building up that trust and confidence. And I think if I can refer you to the second page of his report, paragraph 7, and some of the themes that came out from those conversations and the workshops, is that the Code of Conduct and Responsibilities document should be more empowering, more aspirational, because as it stands, it's very much thou shalt not. And we want to share the values as governors that the trust holds about working together, embracing change, taking responsibility, and being authentic. And I think there is a genuine desire and wish and ambition to set out a clear set of governance documents, a revision of Annex 6, which you can see on the final page, as identified, you know, in our brief slide here. So not only will there be the revised Governor's Code of Conduct and Responsibilities document, revision of Annex 6 to reflect that, a proposal to set up a standards group which will look at a more tiered approach so that any issues or disputes can be resolved, hopefully informally or through mediation. And I think I can speak on behalf of all the governors, is that our struggle with Annex 6 is that at the moment, and I'm sure, Ned, colleagues will feel this as well, but it's it should be the last resort, not the first port of call. And therefore, you know, we do need to find a way of working through this. The recommendation is that there will be a proposal to sign off final versions by the council at its meeting in January 23. In addition to those suite of documents, and I have spoken with Fiona about this, there's also a commitment to develop a governor welfare protocol, which we highlighted with Peter. And the decision required today is for the governors to consider the findings and the proposals that we set out in the report, and to receive in the January meeting a further set of documents. There will be further conversations coming through in the rest of this month and December as these plans are formulated, but I commend this report to you. This is a really important piece of work in setting the journey and our continuing journey as a Council of Governors, and us and our role as governors individually and collectively. Melanie, is there anything else you wanted to add to that, please?
I think you have summed it up extremely well, Chris. Thank you.
Well, thank you. Thank you very much.
Thank you very much, Chris and Melanie. Really helpful to get your sort of perspectives on and bring that, you know, the paper really to life in terms of the discussions that took place. So I'll just bring in a couple of comments if there are any, and Julia first, please.
Thank you, Krishni. Thanks, Chris and Melanie. Really, really good summary. So I was part of the 2 workshops, and I think it's probably the first real sort of detailed piece of work I've done with the governors, the group of governors. And what really, really encourages me going forward are the 3 things specifically. One is that it talks about a compassionate approach. Really, really important, and that's sung out loud and clear throughout the report. Really, the opportunity for storytelling is also there in the priorities and one of the principles, really important, and the real focus on informal resolution, because nobody wants anything to get to a formal stage in any process. So a huge thank you to everybody involved. I found it really encouraging, as I say, as the first sort of slightly bigger piece of work I've done with the council. That really encourages me going forward, that everybody was so open, so honest, and this huge spirit of wanting compassionate, kind approaches to when things don't go quite so well. So thanks everybody, and totally support the direction that it's going. Thank you.
Thank you very much, Julia. I can't see any other people wanting to come in, so can I take it that colleagues are happy to support the work continuing in the direction that's set out? And as I said, the aim is to bring, as Chris referred to, the sort of documents and proposals for final approval to the council in January. So there's obviously going to be some ongoing work around that. And in his absence, we should thank Peter for what has obviously so far been an extremely useful and successful way forward. So hopefully everyone's happy to move on from that. Thank you to Peter, as I say, and everyone who's contributed to that item. We move on then to item 7, which is an update from Nominations Remuneration Committee. And I do want to just note, actually, because we touched on this at the beginning, but in case people didn't pick it up, we are quorate and were quorate about 5 minutes into the meeting. So wherever we are making decisions, we are quorate to make decisions. So I just wanted to be clear about that. It's important to note as we go through the meeting. So item 7, I'm delighted to hand over to Carol as chair of our Nominations Remuneration Committee, which is very active at the moment for reasons that Carol will set out. So over to you, Carol.
Thank you, Krishni. I'm sorry I was a bit late, but you were quorate before I came, so now you're quorate after I arrived, so that's fine. You've got paper F in front of you, which tells you what your Council of Governors Nominations and Remuneration Committee, that's such a mouthful, has been up to. And we have been up to quite a lot. But the first thing that I want to say is that there have been changes to the governance, so the NHS Code of Governance for the appointment of NEDs and chairs. And we needed to reflect this new governance code of governance in our own code of governance, so that we have updated it. And you can see that on page, bottom of page 1 and the beginning of page 2, the changes that we have made to that code of governance, to our own code of governance, to reflect the NHS code of governance. And one of the main things is about number 1, which allows NEDs and chairs to remain in post up to 9 years from the date of their first appointment to the board. So that's as a NED, even if they go on as a chair. So it's 9 years from beginning first appointment to the end. The other thing is that up until now, the trust, as a foundation trust, has been responsible through the through the Council of Governors to appoint NEDs and the chair, but this has been updated in order to involve NHSE, sorry, in the appointments of the NEDs and chairs. And that on the appointment panels, they should involve representatives from either NHS England or the ICS locally. And so we've, thanks to the Foundation Office, we have revised our Code of Governance to reflect these from NHS England. We're just asking the Council to note this rather than anything else. Now, on to the recruitment to the vacancies. At the last Council of Governors meeting, we noted that Maria was going to stand down, and the Council of Governors agreed to appoint someone in her place, but also to appoint an associate NED, so that we have some sort of succession planning into the board, noting that we have several new NEDs at the moment. So we did earlier this week some long listing, and we have I think 6 candidates for the NED position, and somebody's going to tell me this is wrong, but I think 10 that we're taking forward for the associate NED position. The shortlisting will be on the 29th of November, and somebody's going to tell me this is wrong as well, but the stakeholder panels will be on the 6th of December. Thank you, Fiona. And the final panel on the 12th of December, and we will bring our recommendations to the January Council of Governors. At this point, I would like to make a plea, I think, for governors to put themselves forward for the stakeholder panel. Normally the selection panel on the final interview is made up of governors from non-REM, but we need as many governors as we can to nominate themselves to be involved in the the governor stakeholder panel. So if you can, I think it's probably a whole day, Tracy. Please nod.
Yeah. Yes, and it will be virtual, so I just thought I should make that clear as well.
Yeah, virtual with breaks. Virtual with breaks, but it needs to be the whole day, and we need the same governors, I think, to be involved, because then you can make the comparisons moving forward. You will be given a very good information pack from the recruitment company, which non-REM looked at on Tuesday, to help you to make any decisions and help you to be involved. So I think, Tracy, if governors do want to be involved, to contact you ASAP. So
yes, and we'll put a reminder in the mailing tomorrow as well.
Yeah. Okay, that's great. So we're on the journey, and we will report at the next board, at the next Council of Governors. We also looked at the annual fit and proper persons review for non-exec directors, and we were assured that this had been carried out in a fit and proper way, and that all our non-exec directors had ticked the right boxes in the right places. So we bring that to you for to take our assurance as governors. The other one is about the NED and Chair remuneration survey, and as you see in the bullet points, we are in line generally with the NHS providers survey. So just to say that we've done that. So we have 4 decisions which the committee are bringing to the council. So first of all, to approve the proposed amendments to the procedure for appointment or reappointment of a NED, including the chair, in line with NHS England guidance. To note the update in relation to NED and associate NED recruitments, which is going forward. To receive assurance that we've received assurance on the annual fit and proper person review of NEDs for 21-22, and to receive assurance that we as a trust are operating in line with national guidance and benchmarks in terms of the NHS providers remuneration survey. I'm happy to take questions.
Thank you very much, Carol, for that very comprehensive update. Any questions for Carol or members of NomRem? Chris.
Thank you. Yeah, thank you very much, Carol, for the update. As it is a very busy programme of work at the moment. I'd just really to plead to new governors, especially, that please don't be overawed by the stakeholder panel work. You don't have to be an expert in interviewing technique. We are ably supported by the trust in the FT office. Just bring yourself, your skills and your experience. This is one of our specific duties as governors, as a council, to appoint non-executive directors. It's a very thorough, comprehensive and professional process. And actually, I was involved last year in the stakeholder panels. They're good fun. Do you know what? They're good fun. And I say that because, do you know what? We want to appoint non-executive directors who not just bring their knowledge and skills and experience, but also sit with the values of the trust and also sit well with the values of the communities we represent. So please don't be overawed. I'd encourage you to sign up and do take this as an opportunity to contribute and to develop and learn as individuals as well. Thank you.
Thank you, Chris. It's a really important point. I mean, you said it's not always quite so much fun for the candidates to be on the stakeholder panel, but it is it can be I think a really interesting experience, certainly for governors. And Chris is absolutely right to encourage everybody who is available to take part, because it is, you know, one of the most important duties that I think members of the council can undertake is to appoint basically members of the board who will then run the trust. So in many ways, you know, any contribution you can make to that process, whether that's because you are a member of the council who can take part in the stakeholder panel process, or indeed you're a member of NomRem and you're obviously actively then involved in shortlisting and long listing and actually sitting on the interview panel as well. So it's a really, really important process, and one in which your contribution is enormously valuable, because after all, you're representing our community in making the appointment.
That's right.
To the board. And so it's really, really important. So is everybody happy? If there's no other comments or questions, is everyone happy to approve the amendments as Carol has outlined? Obviously note the updates on recruitment that Carol mentioned, and the assurance that the committee has obtained. Everyone happy to support those items as presented? Yeah, great. Thank you very much. And thank you, Carol, for that really, as I say, really comprehensive update. And we move on then to the item 8, which is actually to hear about the life on the ground from a staff governor. I think we've heard now from a number of our staff governors, and today it is from Joanne Dalrymple-Smith, And Joanne's going to talk for about 5 minutes, and then there might be some questions that people want to ask Joanne, but we thought it's a really good way of kind of getting a feel for the council, what it feels like to work in the trust and to be dealing with some of the challenges and opportunities that presents. So over to you, Joanne.
Thank you, Krishna. I may be a little tad over 5 minutes, if you'll just bear with me, if that's okay. All right. Okay. So I'd like to welcome you to my world of home enteral feeding. I've worked as a dietitian for the last 33 years, working in acute, acuity and industry settings across many specialities, including surgical, oncology, paediatrics, learning disability and health promotion. And for the last 19 years in home enteral feeding. I feel as if I've completed the circle as I started at NGH in 1990 and returned to NHFT in 2019. Tube feeding is a way of delivering nutrition directly into your stomach or small intestine when you cannot meet your nutritional or fluid requirements or take drugs orally. The home enteral feeding team manages all home enteral feeding patients, and it is a partnership between the specialist home enteral feeding dietitians and the company nurses from Abbott. Medical conditions where patients are referred for feeding tubes are head and neck cancers, esophageal cancer, stroke, motor neurone disease, progressive supranuclear palsy, gastroparesis, learning disability, and traumatic brain injuries, to name but a few. Feeding tubes are used to administer enteral feed, water, medications, all three of those, just two or one of those, when the oral route cannot be used at all or only partially. This illustrates the different types of tubes. So the feeding routes through the nose are nasogastric into the stomach or orogastric through the mouth, nasoduodenal through the nose to the duodenum, nasojejunal through the nose to the jejunum. Gastrostomy options are percutaneous endoscopic gastrostomy, commonly known as a PEG, which involves the gastroenterologist placing a PEG tube in endoscopy, a balloon gastrostomy, where a radiologist places a tube, a button gastrostomy, which is a low-profile device, and the jejunostomy options in our area are surgically placed jejunostomy tubes and percutaneous endoscopic gastrojejunostomy tubes, commonly called PEG-Js, which are used in gastroparesis. The nasogastric tube is used for short-term feeding, and when longer-term feeding is needed, a PEG tube such as a Frecker PEG is placed in MND patients, that's motor neurone disease, or stroke patients, or a core flow PEG is used for head and neck cancer patients because it's quite easily removed at the end of treatment. If, however, a patient has got an esophageal cancer and you can't endoscope them, then they're referred to a radiologist to have a balloon gastrostomy tube inserted. The Mickey button is a low-profile device inserted into an established stoma tract, often used in children. Bolus feeding is one of the most commonest ways of feeding today, and you use a syringe to give a prescribed amount of feed and flush the tube before and after that procedure. Pump feeding is used to give a larger amount of feed at a prescribed rate, and you can also give water via the pump as well. And medications are given, as you know, in either liquid format or tablets, and tablets have to be crushed. And best practice is to flush the tube with a prescribed amount of water, give a medication, flush it afterwards, repeat the medication session until you come to the end, and then flush the tube again with water so that the tube doesn't become blocked. Now, Northampton Health Foundation home enteral feeding caseload comprises of 542 patients, 343 adult patients, and 199 paediatric patients. The home enteral feeding dietitian assesses the patient's nutritional and fluid requirements and checks if medications need to be given via the tube and creates a feeding regime. The dietitian orders the patient's tube feeding equipment from Abbott and writes to the GP requesting the prescription be sent electronically to Abbott, and the Abbott nurse trains the patient and carers on how to care for the tube and administer feed and drugs. The dietitian monitors new patients, nearly new patients, and established patients on their caseload. There's lots of troubleshooting, liaising with other professionals, and a lot of unplanned work coming in on a daily basis. And the role is very reactive. And as you can appreciate, every patient is an individual living in different circumstances, which makes the role very interesting as you meet them where they're at and work with them in partnership on this part of their journey. And as you're very familiar with the map of Northamptonshire, there are all the areas that we cover. What I'd like to do now is recap on a patient story I shared at the Public Governor meeting in March 2022, where a package of care for a young home enteral feeding MND patient failed at home as the care agency could not meet all of his needs. He was then transferred to Cransley Hospital as an emergency admission to be medically reassessed and to establish what level of care he required. No care home would take him locally in the area, so he was discharged out of area to a nursing home, and this failed within days. He was then returned to Cransley and was accepted by Rushden Park Nursing Home after request for a 24/7 carer was granted by Continuing Healthcare because he had no control over his head. Feedback from his wife was that despite all the challenges they faced, she cannot fault NHFT and is very grateful to Dr. Shah, who helped them realise her husband needed 24-hour care. She feels the nursing home treated them as a family and her husband received compassionate care during his stay. And here he is, enjoying time out in the garden at Rushden Park with the staff who were caring for him. Just to share that he died in May 2022 with his wife by his side, which is what he wanted. And this is what can be achieved with compassionate care. Thank you for listening.
Joanne, thank you so much. I think I'm sure people learnt some very sort of great insight, or had received great insight from hearing about what you do, because it's a very specialist service and very powerful insight in terms of that patient story in particular. I think if it's all right, Joanne, should we invite people to ask any questions? Is that okay with you?
Yeah, that's fine, thank you.
So first of all then, Chris.
Yeah, thank you, Joanne. Thank you for taking the time to share that with us. I think for me, and bearing in mind this is a public meeting, it highlights that the NHS is far more than perhaps sometimes the public see as just doctors and nurses and A&Es and ITUs. It goes to show that I think there's nearly 50. There's 50 different staff groups within the NHS, and part of the allied health professionals, I think, if I'm right, in terms of what you represent. It felt very much like medicine for governors, and it was a really helpful illustration of the complexity and the technical elements of the work you do. But also in a time when people say about the NHS, we're a national repair service, a national emergency service. That particular patient story shows how with dignity you were able to give that patient some in the last days of their life. So thank you for sharing that in a very compassionate and inclusive way. Thank you, Joanne.
Thank you.
Thank you, Chris. I think you really captured that really well in terms of the perspectives that it helps us to understand. Linda, who's our Director of Nursing, would like to comment, Linda?
Yeah, I just wanted to come in to say to Joanna, thank you very much for sharing that, and really heartwarming to see that it's not just the patient you're looking after and working with, but actually supporting that person to remain in their family environment with their family. These are some of the things that the NHS do that not everyone gets to see. And so it's really thanks to you and the team for actually supporting this individual and their family. Thank you.
Thank you.
Thank you very much, Linda. So I don't see any other comments. So just an enormous, well, no other hands up, but Joanne, there are comments in the chat box really thanking you for sharing that perspective with us and kind of helping us understand the really important service that you provide, both from a sort of very compassionate patient perspective, but also from the clearly sort of quite technical elements of what actually happens within the service you provide. So incredibly important to understand, and really appreciate you taking that opportunity to share that with us. So if there's no other questions, I'll bring that item to a close and thank all our staff governors who've shared that. I think we've probably done most of them by now, although they're I don't know whether we've managed to get everyone lined up. So if we have done that, then I think we'll be thinking about how we perhaps take that to a slightly different direction going forward, where perhaps getting our partner governors who work alongside many of our staff to share some of their thoughts about how they work with us and the services they provide, because that's also a really important part of what I think our partner governors can bring to this council. So that's certainly something Richard and I, in going forward for readiness for future council, will think about. And Roshni, indeed, as our representative from the University of Northampton, has suggested that she would be very supportive of that. So moving on then, we're moving on to our strategy and assurance section. Now, I'm conscious Angela was going to join us around 4 o'clock. We'll just keep an eye if she's managed to do that. But I do want to mention a couple of things myself, and then if she's not been able to join us at that moment, we'll perhaps move on to the NED risk and assurance topic, which I know Judith and Sakiba are lined up for. But I'll briefly mention a couple of points, and then we'll see where we are and bring Angela in as soon as she joins us. So the couple of points I wanted to make, you've got a copy of my chair's report from my last board. I just wanted to update from the September board that we did indeed submit the requisite report to NHS England. It's referenced in my report as due by the 30th of September, but we did submit that just to confirm for the council, because obviously very important part that you play in assuring our NED appraisal process. So it's good to just confirm to you that we've reported that the outcome of the NED appraisals to from last year to NHS England. So I just wanted to confirm that. But also linking into the point that Carol made about fit and proper persons, I really just wanted to report to council. This is a sort of bit of a watch this space, but there was a report published a little while ago called the CARC report, which is really refreshing, or looking at refreshing, the fit and proper persons process in relation to director appointments onto NHS boards. And just to let you know that I've been asked to join the National Steering Group for that piece of work that's currently ongoing. And obviously any implications for the fit and proper person test, as it's called, an assessment, will be something that will obviously impact our processes going forward. I don't think it's not going to be, well, I was going to say it's not imminent, but I actually, having said that, I think that the expectation is that the implementation group will come to a conclusion, possibly in readiness for 23-24. So we may have some changes to the process that we will need to take account of, and I just really wanted to let you know about that as a piece of information. So so that's my update. Is there anything that anybody wanted to clarify from the report? I think most things actually from my report have been sort of updated in Fiona's Director of Corporate Governance report since then. So the two things are very much aligned. So if there's no other comments from colleagues around the chair's item, Angela, are you okay to, if we hand over to you for your Chief Executive's report? I'm conscious that you've only just joined us, so if you want a little breather before you do, that's fine. But great, over to you then. Thank you.
No problem, thanks, and good to be with everybody. Apologies for being a bit later. So as ever, obviously people got the report, but I just wanted to focus on a few things that I think are important to share collectively from my perspective with yourselves, and what is the areas of focus that I think are really important for us to be considering. You won't be surprised that staffing remains the #1 area of focus. We've spoke about it before. It is still there. I think it will be there for many, many months to come, and it has a number of elements to it that I think, again, many of you will recognise. We are continuing to experience high demand, and I think it's important that we are now starting to see some of those pressures upon staff as we're living with COVID, in terms of the fatigue, burnout, those sorts of things that we could have anticipated, but I think are now starting to realise themselves. And, you know, as ever, across the NHS, we need to be very clear and confident about how we can support people further. That's not to say we're not, but there's always more we can do and should be doing. And if you align that with the pressures that people are experiencing through cost of living, economic changes, it is very challenging indeed. And I think it's important to say that that goes across the whole of the staff group. People are affected in different ways, but it is something that we're very, very mindful of. We're still working very closely with colleagues through staff side, etc., around cost of living opportunities and measures we can take, but there's always more we can do. Now, in addition to that, people also be aware about the forthcoming strike proposals in the NHS. So that brings itself another suite of challenges. Of course, that's not a strike against the trust, but it is nevertheless an impact that is upon us. And you'll have seen, I'm sure, in the press yesterday around the Royal College of Nursing results that has been now publicised, and we're clear that NHFT, Royal College of Nursing, have chosen to say yes to that strike action. So we do expect and anticipate that to happen. That's not the same across all organisations, but important that we recognise that impact for us and work with colleagues to support that. Patient safety, staff safety will continue to be a key priority, and we'll need to stay close to it in terms of the impact in other organisations across the board. And we've clearly got more ballots to come. So this is something that will not stay with the Royal College of Nursing. There are other further ballots that we can expect. And of course, we've seen impacts in other industries, whether that's rail, whether sectors, and again, will be impacting upon us. So a lot to deal with, and understanding how we respond to that and how we stay safe is very, very much our focus. In addition to that, again, I think people will have seen through a lot of media coverage the real focus on closed cultures and the focus on mental health, learning disability environments in particular. And again, this is an area of real concern nationally, of course, and rightly so. and of course locally. It's important that we stay ever vigilant to it. This is not something that we need national media to remind us of. It is something we are always conscious of, but nevertheless, through the National Director of Mental Health, we have an expectation to undertake a quality and safety review. I'm pleased to say our Director of Patient Safety, James Mullins, is leading that process. And just to remind people, that's a post across our group. So that's an opportunity we're taking with our group partners. And through that exercise, we are examining everything that we have that gives us assurance around those measures and equally challenges us further in terms of anything that we could and should be looking at differently through any learning that's emerging. So a really important area, and I'm sure governors would want to be updated on that in due course, and it probably would be useful for James to also come and share some of that as that becomes more emergent, and certainly the board in terms of always understanding and being open to the risk of closed cultures is one that is very important that we continue to focus on. In addition to that, I think again across the NHS and the care sector at large, the financial challenges are significant, and I think we are seeing that you know, internally at system level, regionally and nationally, and we're seeing that in social care and in our unitaries as well. So that remains ever challenging, and what and how we're responding to that is to obviously stay a very clear partner in our local system, but to also explore and how and consider how we can drive further value through our organisation, and value in the sense of outcomes and cost and, you know, productivity, and understanding where in which we can do more and should do more. So a lot of work to explore that at the moment. So I think, Krishni, those are the areas in which we are very, very focused. But I think it's also fair to say and right to say that this next period will be one of the most challenging that I think we will face. That's not to say that COVID experience has not been challenging, but I think with the sort of range of things that are upon us, I think it's going to be very important that we stay close to how those challenges are affecting us as an organisation. Thank you.
Thank you very much, Angela. And of course, Angela's report is also available from the September board for you to look at sort of some of the broader things, that the developments that are in the backdrop. But I think you rightly, Angela, chosen to sort of update us on the most recent developments and current issues that governors certainly need to be cited on. Are there any questions that colleagues would like to ask, take the opportunity to ask, you know, collectively of Angela in particular and the executive team? Is there anything else that you would have liked to hear more about in terms of what's the current scene, if you like, within the NHS? Okay, Chris?
Myself in. Thank you, Angela. Thanks for that update. I think your report at 13 pages just shows how much is going on, both locally and nationally. And I think as governors, we recognise not only the national sort of top-down directives, but also the need to build up relations with social care partners, with partners next, you know, in terms of across health and social care. So there is a lot going on. I think the offer perhaps of James coming to talk, I'm not sure if it's on our work programme as a specific issue, I think would be helpful, I think, in terms of certainly, you know, when I'm out and about, you know, talking to people, I think, you know, there, as you say, there's a sense of unease. I think that the nursing decision to strike is very much of the moments of the time, and the sense of enough is enough. And I think the workforce challenges are huge. So at a very basic level, thank you to you, your team and the executives and all staff in every corner of the trust across all our 100-watt plus buildings that we operate from. Thank you. I think governors would find it helpful, I think, to just get an update on that programme of work around, you know, patient and service user safety. So thank you for that offer. And also, I think at one level, as Christian acknowledged it early on in the meeting, the work we're doing with the KGH governors you know, about joint working. You know, I speak to Peter Woollerscroft Maple Blades quite regularly about, you know, how we can help.
Yes.
In terms of reaching out to communities, as we talked about at the last ICS workshop last month. So thank you.
Yes. No, thanks, Chris. And just to say, I didn't mention it specifically, but obviously the work we're doing around our mental health, Learning to Speak Autism Collaborative, continues to mature. And, you know, part of that, obviously, we mentioned at the joint session with KGH governors. And just to say that Anne Rackham, who is the Senior Responsible Officer for the system on this, working with myself, we met with Rashmi from KGH to just further explore what more we could do around our local communities. Really helpful. And again, we were able to share with Rashmi some of the things that we are doing that perhaps he wasn't aware of. So I think those sorts of sessions are really helpful, Chris.
Thank you, Angela.
Thank you very much. Thank you, Chris, and thank you, Angela, for suggesting we bring James in at the appropriate point. I think it's particularly around the assurance around the work that we're doing following the sort of developments in Manchester, I think would be helpful. So perhaps we'll clarify the timescales on that outside the meeting. Before I bring Julia in, perhaps just bring Matthew Golby in. Matthew is our partner governor for West Northamptonshire Council. Matthew?
Yeah, thank you,
Matt,
Christian.
Really, I usually call you Matt. I don't know why I've called you Matthew today. You're not in trouble, Matt.
Yeah, that's what my mum calls me, Matthew. Yeah, I just wanted to thank Angela for her report. I found it really interesting. It was a lengthy report, but it just shows how much work everybody's involved in. And I particularly welcome your comments, Angela, around how we work as a system with partners, you know, to look at not only driving costs, but hopefully better outcomes for people. And that's what, you know, a huge part of the work we're all trying to work on across the system, you know, is really important. And just to acknowledge also that massive challenge to the local system as we go into winter now, and hopefully we can stay together and work together to you know, to try and deal with it as best as we can. But it is off the back of a very difficult period. It's going to be, you know, even more of a challenge moving forward. But I just wanted to welcome your points around costs and outcomes, really, that you know, hopefully we can be more efficient working together, but more importantly, you know, keep our eye on improving outcomes for our residents and patients, basically.
Yeah, no, thanks, Matt. I think it's just so important to have that sort of, as you say, common lens on how we're improving outcomes, because we know that actually we can all be involved in services, but actually if we integrate further and look at the outcomes, we can achieve more. And that has to be the bit that we need to stay very optimistic about. So really welcome that. Thank you.
Thanks very much, Matt. Really important point, and you know, obviously the key point here, and much of the sort of changes that have been going on within the NHS is all about recognising really that partnership working is the key to making things better for our community, and hence, you know, the importance of partner governors here being represented as well. Julia, final comment then, Julia.
Thanks, Krishni. Thanks, Angela. It's just to bring a slightly different perspective or different level of assurance, I think, really, for around some of the staffing issues for our governors. Just to say that at the Quality and Safety Committee a couple of weeks ago, we took the opportunity to look at one of the risks that we're responsible for, which is around external factors that might affect our staff wellbeing. And we had quite a detailed discussion with some of the executives that were part of the committee around the actions that the organisation are taking, that we are taking collectively as a trust to support our staff. But what was very encouraging was the level of depth and the level of detail that that they're looking at, and trying to really look at in detail at every single aspect of supporting our staff. So right the way from, you know, musculoskeletal problems to what causes stress, what causes workplace anxiety, etc., cost of living, all, you know, very holistic view. And it's just that we came away with an assurance that absolutely everything that everybody could think of, you know, we are talking to staff, working with staff, and absolutely take it incredibly seriously. So I just thought I'd bring that other level, that other perspective from quality and safety.
Thank you very much, Julia. Angela?
Yeah, I just wanted to say that thanks for that extra assurance on that, Julia. But I think the other thing I would want to say is, you know, not to miss the opportunity to say thank you to all of our governors who are also helping us during this period, because you know, we talk about our staff, but when I talk about staff, I'm actually in inclusive language thinking about all of you as well. So it's very important that we say thank you to all of you. But equally, if any of you are coming across any of our staff over this next period, please take the opportunity to say thank you to them, because what I'm conscious of is this is going to be a difficult period, and sometimes it is about the ways in which we can support, and we're doing so, but sometimes it's just as simple as saying thank you, and actually somebody just knowing that it's recognised. And I think it's a simple thing, but we can all do it, and that's why I would say thank you to you, and let's pass it on, and let's just make sure we're all in that sphere, because we have some incredible people, that I'm under no doubt.
Thank you very much, Angela. Okay, well, we conclude the report then from myself and Angela, and we'll note the action to bring James Mullins back to present to us at an appropriate point, and move on now to the NED risk and assurance topic that we wanted to give you an update on. And you may recall that this is the self-harm indicator that was selected actually as the quality indicator that the governors wanted to focus on. And we thought this was a useful opportunity to bring you an update on where we are with that. And Judith and Saqib, I think, are leading on this, and are going to share some slides with you. We were going to bring it back to the September meeting, but obviously that was changed, as we know, so we brought it to this meeting. So over to both of you.
Thank you. So I'm Saqib Ali, one of the non-exec directors and audit chair. So we'll take you through this update, where we're at, and then also the way forward. So on to the next slide, please. So as you can see, we were challenged to reduce self-harm incidents by 25% in 1 year at Berrywood Hospitals Bay ward, and then also that we would reduce self-harm. So this was quality priority 5, and that was what was selected in March. So moving on.
In June, our internal auditors, TIA, presented their findings after having conducted their internal audit processes. And the findings were reasonable assurance for our systems, actions and data processes for reducing incidents of self-harm on Bay ward, the specific ward that they were auditing. Now this is it's a good outcome, and there were 4 specific strategic findings from the audit. First was that we've actually exceeded our target of reducing self-harm incidents to 61% rather than our target of 25%. However, the underlying reasons for this were unclear, and the key drivers for it were not identified. So that was the first strategic finding. Second one was around actions which have not been completed, which were planned, and this was a direct result of COVID, but of course the actions remained outstanding. That there was integrity issues on data. In 2 instances, the auditors audited, there were incidents that were not logged, and therefore they were not included in reports, and that the governance arrangements around strengthening the oversight and the monitoring reporting this specific area needed to be strengthened. However, there was also good practice identified, and that was that the Bay ward representatives were involved in the quality improvement project when it commenced just after start of COVID pandemic. Therefore, they're involved in managing the process and ensuring that it was fit for purpose. Now, these strategic findings were then broken out by the auditors into 9 separate findings, which have action plans attached to them. There were 3, apologies, there were 3 mid-level or important findings and 5 routine or lower level findings. And for the management and the action plans, I'll hand you back to Steve. And we have the
Thank
next
you.
slide, please. Thank you.
Yeah, thank you. So matching what was found, there was an action plan put in place. And for example, on number 1 was to understand the number and narrative. So to understand what the data was showing us. Secondly, to report and monitor that quality data. To introduce a lessons learned log. To reinstate the ward-based self-harm quality improvement group and review and strengthen. And what does this actually mean? Obviously, when a report is found, is made, then they come up with various findings and the 9 items, as was mentioned by Judith. So what we need to learn from this is how we can deal with the findings that were made, how we can improve from it, and how we can improve from there and take any learnings on board. So I think that was the important thing. So whilst at the high level, we did achieve 61% versus a 25% improvement, it's understanding why that was, what the data showed us, how we can track it better, and also how in the future we can hopefully deliver on, achieve better outcomes, and to understand why those outcomes were delivered. Because obviously we don't want anyone to have any self-harm, and it's understanding what's driving that self-harm in the first place. Okay, thank you.
Having received the internal auditor's reports is really only one aspect of our assurance. We then, so again, restating that we have exceeded our target, but at audit committee, we also, having read the report, discussed with the auditors what their findings were, and also the relevant executive directors attend the audit committee, so we're able to discuss the findings with them as well. Clearly, we're pleased with the action that were already in place, but we also wanted to ensure that the manner in which the actions were defined and the associated deadlines were actual deliverable and would close the concerns, address our concerns by giving us assurance. And this is always part of the audit committee process. We also asked the auditors to track progress on delivery of the action plan, which is again usual, and we also continue to maintain oversight of the completion of the action plan in audit committee, but also in QNS. Hand you back to Saqib.
Thank you. So where are we now? So as you can see, the progress on the action plan. So various items have been achieved. So robust processes over data checks, the detailed investigation, staff management on Bay wards to be fully engaged in the process, governance arrangements formalised, and assurance for the named group of people classified as completed. And then the last one that's been completed is also the arrangements put in place for management and reporting arrangements. However, there are some others that are target completion for mid-December, which the lessons learned. So as I mentioned, to understand how and why there is self-harm and how we can hopefully identify and eliminate that happening. As part of the improvement of 22 and 23, the project charter to be appropriately approved and the evidence of the approval retained. And then the job title of the trust staff that would lead to an objective to be documented. So there are some items that have to be completed, but I think we're making good progress. And we're thankful to everybody, along with everything else that they're doing, to have addressed the findings of the audit report and brought us to where we are now. And thank you to the governors for requesting this to be looked at.
And can I just also add that in fact all 3 important issues have been closed, and the 3 outstanding issues are routine, and as Saqib said, they are due to be closed middle of next month. Thank you. Any questions?
Great. Thank you very much, Judith and Saqib. I think what that shows is an illustration of the scrutiny that actually the audit committee and audit, the assurance processes that actually work around using internal audit, how that works. As you would expect, it's always, you know, it's always obviously a detailed review of a process or assessing a sort of progress, a particular set of actions. And actually what that's told you is exactly where they are, what sort of actions, you know, what were the findings, what were the actions, what's the broad learning, what can we do differently as a result. And even something as complex as self-harm, which is obviously a significant priority for us in reducing that, there are always things that we can do to improve, and actually what you've seen is the sort of evidence of how that's been taken forward. So hopefully that was a good illustration for you of a process that's been undertaken in terms of that audit. But very happy if anyone wants to ask any questions about that, just to if there's anything that isn't quite clear. Hopefully we've explained that in a way that is reasonable and good for you, but I'm very happy to clarify anything. Chris.
Look, I'm sorry, I seem to coming in at quite a lot this afternoon. I'd encourage governors on the call, look, do speak up. Don't sort of feel that you can't raise a question either here or if you prefer in the chat box. Certainly this was an issue we were concerned as a council, and thank you for that update. That's helpful, as was something in the quality count indicators. Forgive my ignorance, I might have blinked and missed. Was this looking just at Bay Ward? Well, sorry, because the reason I ask this is that there are a number of inpatient settings across the trust, not just Bay Ward. And in and of itself, it's great to see the work that has gone on. And I'm wondering how the learning will be embedded in other inpatient settings. And also, perhaps as a supplementary to that, the human factors around this, because, you know, I understand the systems, the process, the oversight, the scrutiny and the assurance. I get all of that. But there's people at the heart of this, and staff and training and their development and awareness, all of those issues perhaps didn't necessarily come over in the report to the extent I thought it would. So 2 questions, one around human factors, and second, are these lessons being learnt in other inpatient settings across the trust? Thank you.
Okay, did Judith or Saki want to comment on that, or do you want to come in, Judith?
Yeah, if I may, Chris, I mean, absolutely excellent question. The way that the lessons learned aspects and in fact the human aspects of this will flow through to other wards is through the embedded governance. And in fact, of the nine findings, 5 of them were related to governance and ensuring that it's properly embedded. And if I may sort of assure you that the way we gain assurance is that the Quality Account Assurance Group report, who is responsible for gathering the data and ensuring that the lessons learned are embedded, they report to Quality Forum and Quality Forum to QNS. So we get the data, we get the report on this, and it is scrutinised, and we are assured and every time the QNS meets. So that is how I would say I am assured that this is trust-wide, not just in specific ward.
Okay, anyone else want to comment? I think Sharon wanted to come in actually. Sharon.
I do. I understand that what you've done from a quality management perspective. I find it a little disappointing that there isn't actually a finding on what made the difference between the 25% target and the 61%, because what actually did people do differently to have that impact on the people, and that didn't come across for me. And I think that's kind of echoing a little bit what Chris was saying, is you know, what do we need to do differently to specifically to be able to keep that impact across across the trust. And secondly, I think that there was two elements, if I understood that from the beginning, which was the Bay Ward element, but also a CAMS element as well. And we didn't hear an update on that portion of it.
Thank you, Sharon. And I think that's what actually, in a sense, the sort of Seki was alluding to, is the fact that actually we did, in practice, we didn't really get a clear sense actually through the process itself why we'd made that reduction. So part of actually the actions we needed to take as a result of the audit was to address that issue. But I'll bring Melanie in, because Melanie may have a comment on that. Melanie?
Thank you. Well, yes, I was just going to reflect, and I think it is right for us to continue to dig deeper. But I think one of the challenges is, and it's a challenge that we frequently come across in terms of finding assurance in particularly in quality and safety areas, is that there are multiple factors that influence the level of harm, the level of restraints, the level of, there's never ever one silver bullet that kind of has an impact one way or the other. And the acuity of patients, the number of patients, and a wide range of elements all play a part in incidents of self-harm. So I think that we will continue to push, but I think it's just important to point out that it is frequently very difficult to assign changes and trends to individual elements or one particular factor. And the truth of the matter is that it will be there are often majority factors, and that's what we might try and aspire to here, but there are often a broad level of change across a broad level of factors that end up in the result. Sorry, I probably haven't articulated that quite as clearly as I intended to, but just it's the complexity of some of these deeply challenging areas of patient care.
Thank you, Melanie. So I can see there's an enthusiasm from a number of non-execs to come back in. So, but maybe before I do that, if I get a final question or comment, Chris, just in case I bring everybody in and then there's a separate question. I wonder if, Chris, you want to ask your question, and then I'll bring the non-executives in just to close that off. So, Chris, do you want to comment further?
I would like to. I know. Did Joanne have her hand up? I think she might have been before me.
No.
No. Okay. No. All right. Yeah, we recognise this is multifactorial, however you want to describe it. But Sharon's point is well made. To go from 20% to 60%, that is a huge increase in any way you calculate. And it'd be good to know, well, how was that achieved? That must have been through changes in behaviour or systems and processes. But it would be that level of improvement in performance, I think does need to be fleshed out a bit more so we can understand and how that can benefit through whatever processes exist in the trust, whether it's Quality Forum or the Quality Account Review Group, whatever, as how that could be shared across other settings. So that would be my only reflection, if I may.
Thank you very much, Chris. Right, so I can see that Saqib and Judith want to come back in, and then I think helpfully Julia wants to come in too, which probably with a sort of broader perspective about lessons, how we share lessons learned and that sort of thing. Saqib first?
Maybe Judith, do you want to go first either?
I'm happy to go first, sure. Thank you very much. Chris, again, really good question. With statistics, it's very, very difficult to ensure that that you're not seeing a biased picture. And the team actually carried out in-depth analysis, statistical process control analysis, so heavy-duty statistical analysis, to seek to understand why it was that initially the self-harm data worsened and then got better, if you like. And for 2021, so during the period August to December of 2000, there was a major impact on self-harm numbers because of one specific patient was then discharged. So it skewed the data. So in fact, the 61% is a skewed, if you like, result. So even if you back out that one patient, I believe we've still met our targets. So that analysis has been carried out, but it was skewed, fortunately, because of that one specific patient. I hope that helps to put some context onto that specific threshold. Thank you.
Saqib, do you want to comment?
Yeah, I just wanted to briefly say that obviously part of the using methodologies from other industries, that obviously as NEDs we all bring in our other experiences. So for example, Kaizen and continuous improvement. Obviously that's why I was saying earlier in the piece that I did about trying to understand what are the drivers to some of these, and then making sure that those learnings are taken into other areas, and that once we understand, for example, as Edith has called out, that there was one person that skewed it. If we understand what some of those drivers are, then whatever the number is, however many people, because at the end of the day, it's actually, these are all individuals. And I think that's the really important thing that we have to remember. You know, we're looking at it as a mathematical 61 versus 25, but these are people. And I think that's the most important thing.
Absolutely. Thanks, Saqib. Final comment then from Julia.
Thanks, Krishni. So just to give some assurance from the Quality and Safety Committee level, certainly these indicators are part of a full suite of reports that Julie Shepherd kindly brings us as lead around this area. And you're right with the question, it was Bay Ward specifically, this priority to reduce the number of incidents. And we had a detailed plan around the different aspects, different actions that were being taken. And the second one, rightly, you asked earlier, was around the children and young peoples in CAMHS, and that was around a thematic review for all the different incidents. And we certainly received a green for compliance for that, because again, as Udit was alluding to with the adults, that was around very specific individuals with individualized care plans that were receiving full support, but the numbers completely skewed what we were thinking was a trend. So that certainly came to us in detail from Julie specifically. Learning, just a quick word about learning. We're constantly asking through all our different governance routes around how's learning shared, etc. And one of the most important pieces of assurance I've heard recently was that, especially sort of thinking we've had nearly 2 years worth of pandemic situation, some of the officers are taking the opportunity to completely review how we do share learning, because a number of key meetings have been postponed and things were shared virtually rather than face-to-face, etc. So there is currently a review, and it came up through the Safety Committee actually, which feeds into Quality and Safety, and there's a complete review happening at the moment of all the different ways of how we share learning, from whether it's learning from deaths, whether it's learning from incidents, safety incidents, good practice as well. So we'll be able to bring you some more assurance from that when we hear a bit more through Safety Committee and up through Quality and Safety where that project's actually got to. But we do seek at all the different levels. Where's this shared? How is this informing practice? And there's a whole raft of ways that we're assured that staff do hear about it. And of course, staff themselves can tell us whether they've heard about particular complaints or incidents, etc. Another level for us. So ongoing work, I think, to review it, which is really good. Thanks, Krishni.
Thank you very much, Julia. I'm conscious that we've sort of getting to a point where we probably need to conclude this item, but given that we have suggested that James Mullins comes back to talk to us about patient safety and the whole sort of, you know, there's a huge amount of work on patient safety, which I think is going forward, partly because of the new framework, but also because of developments in the mental health sector in terms of incidents. So actually, it might be a good opportunity, I think, to sort of wrap that back up into a further session on patient safety, which obviously is something that also actually worth colleagues sort of joining the board meeting, where there's quite a significant report from the patient safety group that's also presented to the board meeting every board actually. So and self-harm is definitely part of that. So it'd be useful for colleagues who really want to perhaps explore that area a bit further, could observe the board for that. But thank you very much for all your questions. And as I say, I think what we can do is roll up sort of any further assurance that we can provide on this area into Angela's suggestion that James comes and talks to the council about patient safety, because self-harm is definitely very much a part of that. So appreciate the work that's been done, and thank you to everybody who has been involved in that, and thank you to governors for selecting that particular indicator for audit. Finally, we have any other business, and we have about 5 minutes just to before we close the meeting and rightfully give you a break before we go into part 2. So I just wanted to bring Chris in here because I know there's an item of any other business that Chris alerted me to. So would you like to come in at this point, Chris?
Yes, thank you. Yeah, just in terms of full disclosure, as you know, I'm a trustee at Kettering Mind, and I was at a fundraising meeting campaigning Tuesday it was, when in the discussion around comments around fundraising within the local area, I was asked about the future of Cransley Hospice and that fundraising efforts had been impacted because there was a proposal to bring the hospice into direct NHS management control. Now, I said I'm not aware of anything issued, but I would of course find out, and undertook to raise a question today and I emailed Krishni with her agreement to bring it up under AOB today. So I'm not necessarily looking at it as an answer, but in part of my role in representing the views of the public and the public at large, that was a question that I wanted to relay to the Trust about the future management and governance arrangements of Cransley Hospice, please.
Thank you, Chris. So I thought it might be useful just to take a couple of minutes to respond to that, because I mean, we are actually in regular discussion about sort of developments around Cransley Hospice Trust in our private meeting of the board, and the reason why it's private is really just because there are some there's a business case and some commercial negotiations as well that are ongoing. But really important to say that there is no change to our relationship with Cransley. Cransley in effect acts as a sort of part commissions our end of life care that we provide at Sunley Court, and we are actively working with them, and our key focus is on addressing the lease situation, which I think has been is a matter of public record, and has been sort of as far back as probably March 2020. So working very closely with them to secure a lease extension at Sunley Court, and then find a permanent solution from which that service can continue to operate. And just to be absolutely clear, it's already NHFT staff who provide services at Sunley Court currently. So there is, you know, the only focus we have, and we do work very closely with them. I have conversations periodically with the chair. Angela is also in contact, and indeed execs are, with Cransley executives, but as I said, myself with the chair, to keep them informed and involved in the conversations we're having regarding the lease extension and basically opportunities for us to secure a permanent solution for the home. Really, it's the site that we're focused on. So no other change, and no change. So I mean, it may be that people don't necessarily understand the relationship we already have with Cransley, and that might be born from that. And you know, and there may be some uncertainty about where this, because of the long-term option around the Sunday Court site, you know, may have been what people were referring to, but other than that, it's really no change. And that's the focus that we've got working actively with Cransley. I'm happy to bring, is there any executive colleague who wants to add to that or clarify anything otherwise? Hopefully that answers your question, Chris.
Yes,
Great.
thank you. That's helpful to get some context. As you say, I think the perception, you know, and of course, you know, word of mouth can get, you know, be lost in translation, but that does helpfully provide some context. And in turn, that will help me to provide some feedback to the group that raised the issue.
Great. Thank you very much, Chris. So I think the final point that I just wanted to make was just to remind everybody that our next public meeting will start at 3 o'clock on Thursday, the 12th of January. I think it was originally proposed to be a later time, but we wanted to bring it earlier in the day because we found actually as part of the arrangements for council that attendance is better earlier in the day rather than that very late session that we did as part of the trial. So just to remind you that that's the timing of the public meeting for the 12th of January. But I'm going to bring this public meeting to a close and then go into our private meeting, our part 2, which actually is due to start at 5 o'clock. So we have an opportunity for a short break and look forward to members of the council joining for private session at 5 o'clock. Thank you very much, everybody, for your contributions today. I really enjoyed the meeting. Thank you.
Thank you.
Thank you. Bye.
Bye.
Thank you.